World Health movie.
Yeah.
That sounded better in my head. Countries and stages. Afghanistan.
Okay, don't be rude.
Some of the major diseases in Afghanistan are tuberculosis, poliomyelitis, and pneumonia. The CDR is one of the highest in the world. The CBR is also one of the most highest in the world. The natural increase rate is 2.7%. The physicians per person is 0.2782. Hospital beds per person is 0.4 units for 1,000 people. Afghanistan has public health care. The health expenditure per capita in Afghanistan is growing at 7.18%. AIDS and HIV are rarely found in Afghanistan.
We're gonna have to fix that.
Low death rates and birth rates show that Mexico is in stage 3 of the demographic transition model and are going through urbanization. The population is growing at a rate of 1.1%. There are 2.383 physicians per 1,000. The dependence ratio is 50.27%. There is less than one hospital bed per person. The decline in mortality is due to Mexico creating new hospitals, and the expenditures on health is 1.15 thousand per person. Public health insurance is paid by the government, while private health insurance costs $400 a year. The AIDS in Mexico is low, but it varies throughout the country. And the NIR is 1.352%, the CBR is 18.78%, and the CDR is 5.26%.
For the U.S., the CBR is very low, which puts it in the stage 4 for the DTM, and the CDR is also low, but it's slightly increasing, and one day it will pass the CBR pretty much. It will probably pass it in stage 5. The NDR is low because the CDR and the CBR are low, which makes the NDR low because those two together make the NDR low. For epidemic stage 4, it is in stage 4 because they have better health care for the elderly, which makes them have longer lifespans. And there is bigger addictions to opioids, and less people like exercising, so they relax more, and more eating unhealthy foods, which don't help them in their lives. AIDS is a big part of deaths in the U.S. because over 600,000 and 75,000 people have died from AIDS ever since it came to the U.S., and over 13,000 people per year die from AIDS. Some major diseases in the U.S. are cancer and heart disease as well, that kill over a lot of people every year.
Okay, Japan has a CVR of 7.3 and a CVR of 10.1. Which also is stage 5 in the epidemiological stages because it has different diseases that are reemerging again, like AIDS. They have a very high concern for AIDS, even though it's not really growing too much, but they think it will eventually in the future. 90% of people here have healthcare, public healthcare, and private healthcare normally is a backup, and the government uses 11% of their about $1 trillion in spending to help on healthcare. It also has a very high elderly dependency, which is another way to show stage 5.
Malthusian believes that the population increases geometrically and the food increases arithmetically.
Neo-Malthusians believe that resources are needed much more and we're running out of it very fast because of population and there's just not enough to go around. Then they're scared of a lot of stage 2 countries needing a lot of resources, which puts a big gap between the population.
Possibilists believe in possibilism, which means they believe that humans can modify their environment so they're able to live in it. Like a swamp, they could add bridges to get across to land where you could build houses on. And they believe you can change the environment to support population, which is again changing the surroundings for them to be able to live in it.
Utopians believe they can adapt to our population and can produce enough resources. Resources are created by human ingenuity. Boserups thesis: the more developed countries have better agriculture improvements based on past population pressure. This is why developed countries have more food resources.
I'm gonna get half of it right.
Right.
Okay, you timed it. I'm gonna add some stuff in there.
Why?
Because
And
we missed stuff.
We did?
Yes.
I added some of that. I was like, oh shoot, I forgot how to do diseases.
We have to say how.
Oh, let's not start a new one?